Good day, everyone. This is Engineer Gio Joseph, Safety Engineer. First of all, thank you for joining today's lecture on hospital emergency codes. These codes play a crucial role in maintaining safety and efficiency in healthcare settings. Understanding them is essential for anyone working in or interacting with the hospital environment. Purpose of emergency codes. Hospital emergency codes are standardized signals used to communicate urgent or critical situations quickly and clearly among staff. Their primary purpose is to ensure a rapid and coordinated response to emergencies, minimize panic and confusion, maintain patient and staff safety, streamline communication within the facility. Why are codes important? In high pressure scenarios, clear communication is vital. Codes provide a discreet way to convey critical information without causing alarm to patients and visitors. They help manage a wide range of emergencies, from medical crises to security threats, in a controlled manner. What is emergency codes? Emergency codes refer to standardized protocols and alert systems used to communicate various emergencies quickly and efficiently. These codes typically consist of a color code or a code word that signals different types of emergencies such as fire, cardiac arrest, bomb threat, hazardous materials spill, and so on. Each code triggers specific actions among hospital staff, such as summoning specialized teams, evacuating areas, or implementing safety procedures. These codes are crucial for maintaining safety and managing emergencies effectively within hospital settings. How to activate emergency codes? If you want to activate any type of emergency, follow the given steps. 1. Call emergency hotline number 2222. 2. Mention your name and department. 3. Type of code. 4. Mention the room number or any landmark. The first code is code red. The first identifier have to activate the code red by verbally, manual call point and emergency number 2222. What is the definition of code red? In the context of a hospital, code red is the emergency code used to indicate a fire or smoke within the facility. This code prompts immediate action to address the fire emergency and safeguard everyone in the building. What is the purpose of code red? The primary purpose of code red is to alert staff, notify hospital staff of the fire or smoke situation so they can take appropriate actions, initiate fire response protocols, trigger specific protocols designed to manage fire emergencies, including evacuation procedures, containment measures, and communication with emergency services. Ensure safety. Protect patients, visitors, and staff from the dangers of fire and smoke, which can pose serious risks to health and safety. Next code is Code Yellow. Code Yellow stands for External Disaster. What is external disaster? An external disaster refers to a significant event or incident that occurs outside the hospital but has the potential to impact the hospital's operations, resources, and the community it serves. This can include natural disasters such as earthquakes, floods, and hurricanes, industrial accidents, transportation accidents, terrorist attacks, or any large-scale emergency that results in a sudden influx of patients or requires the hospital to provide emergency assistance and coordination. Next code is Code Black. Code Black stands for Bomb Threat. Bomb threat is a critical alert indicating that there is a potential or confirmed bomb threat on the premises. This code triggers a series of urgent and coordinated actions designed to ensure the safety of patients, staff, and visitors. If you are getting any type of bomb threat through mail, letter, call, or message, then you should activate Code Black through the emergency number 2222. Next code is Code Grey. Code Grey stands for Severe Weather. Severe weather is an alert used to indicate that extreme weather conditions are impacting the facility. This code prompts immediate actions to ensure the safety and protection of patients, staff, and visitors. For example, high winds, hail, dust storms, excessive precipitation, torrents, thunderstorms, lightning, tornadoes, cyclones, blizzards, and floods. Next code is Code Orange. Code Orange stands for Hazardous Material Spill/Release. Code Orange typically refers to a situation involving a hazardous material spill or release. This can include chemical spills, biological hazards, or radioactive materials. There is two types of hazardous material spill. 1. Minor spill. 2. Major spill. If the spill is less than 1 liter or 1000 cc, is called minor spill. If the spill is more than 1 liter or 1000 cc, is called major spill. For the major spill, we should consider the severity of the condition. The spill is major, then the emergency code should be activated through the emergency number. Next code is code blue. Code blue stands for cardiopulmonary arrest. In the hospital, if you hear a code blue, it signifies a medical emergency where a patient is in need of immediate resuscitation, often due to cardiac arrest or respiratory failure. The declaration of a code blue prompts the rapid response of a specialized medical team trained in advanced life support. Next code is code silver. Code silver stands for active shooter with weapon, hostage situation. A code silver in a hospital typically indicates a situation involving a weapon or an active shooter. This code prompts an immediate and coordinated response to ensure the safety of patients, staff, and visitors while neutralizing the threat. It can be 1. Person with a weapon, active shooter hostage situation. 2. Use of firearms. 3. May or may not have a pattern of selected victims. Next code is code brown. Code brown stands for utility failure. If there is any type utility failure and it is affecting the departmental or hospital normal routine work or life safety. A utility failure in a hospital can have serious implications as it directly affects patient care and safety. Here are some examples of utility failures. Power outage, water supply failure, heating, ventilation, and air conditioning (HVAC). System failure, communication system failure, data system failure, medical gas supply failure. Next code is code pink. Code pink stands for the child or infant abduction or missing. In the hospital, the term code pink typically refers to an alert indicating that an infant or child is missing or abducted. It prompts a rapid response to locate the missing child and secure the hospital to prevent the abductor from leaving. Procedures include lockdown, securing all exits to prevent anyone from leaving the facility. Alert staff, informing all hospital staff to be vigilant and search their areas. Monitor exits, stationing staff at all exits to check identification and search for the child. Surveillance, reviewing security camera footage to trace the movements of the missing child or potential abductor. Communication, coordinating with local law enforcement and other relevant agencies. Next code is code white. Code white stands for combative person, assault, abusive behavior, violent situation without weapon. Code white in the hospital refers to a situation involving a violent person, often a patient, visitor, or staff member, where there is a need for immediate assistance to manage the situation safely. Code white can be activated when there is an abusive or assaultive person or threatening within a facility without a weapon, knife, gun, etc., direct or verbal threats of harm, intimidation of others by words and or action, refusing to follow the rules, policies, extreme suspiciousness, destruction of property. End of disaster or all clear. When the emergency situation has been resolved, any of responsible individuals can declare the incident all clear or end of disaster. Thank you all. I appreciate your participation. If there is any questions, feel free to ask anytime or seek clarification. Your feedback helps me improve future training sessions. Please share your thoughts with me. Thank you for your time and attention. This is Engineer Geo signing off.